bones supporting your teeth? You lose them, right? They get loose and they fall out. And that's oftentimes why older adults lose their teeth, is because of periodontal disease, okay? So again, if you're working with a resident in their mouth and you're seeing that those teeth are wiggly, example of healthy gums, you can see how they're nice and pink. It kind of, we call this stippling on the gums, where it looks like it's kind of like an orange peel, okay? And here is infected gums. You'll see there's a red border around those teeth, and you can tell that there is plaque on those teeth. If you take a toothbrush here, this is gonna bleed. Absolutely will bleed. And that's a sign that that person needs more help. Okay, so I just want to share this with you from my perspective as a dental professional. This is tartar. So the previous picture, you can see this is plaque, this is soft stuff, and that's what we try and brush off when we're brushing teeth, okay? If we don't get the plaque off the teeth, the plaque hardens and becomes tartar, okay, or calculus. This is for your orientation. It's the lower front teeth, it's the back, and this is all tartar. Okay, so this is how that looked after the dental hygienist removed all the tartar. You can see actual teeth, right? And this tartar, more surface area for the plaque to sit on, and so we have more dental disease. So it's important to, if you're seeing anything like this in your residence, also tell somebody, because there's an infection going on there. Okay. This is what periodontal disease might look like if you're looking in a resident's mouth. Again, here is the gum. Here's where that gum is supposed to be. This is all root. And I hear people telling me, oh, Angie, old people get long in the tooth. Right? It does look like their teeth get longer, but they really don't. Right? The teeth aren't getting longer, you're just seeing the whole root. And these teeth, if we would wiggle them, they would be almost falling out. So that's another thing to be looking for. Okay, so we talked about some of the things to look for with your residents and how oral disease can affect our mouth. But it doesn't stop there. Let's talk about what else can happen to us because we have a sick mouth. So it's pretty important that your residents eat, isn't it? Yeah, you want to keep their weight up, right? You don't want residents losing weight. Is that true? Yes. So if someone has a toothache or loose teeth, how well can they eat? Or if they have a denture that doesn't fit very well, how well are they eating? Not very. So if you see that someone is eating differently, you might check what's going on in their mouth. How many of you ever had a toothache? Anybody ever had a toothache before? Mark, yeah. How did you feel that day? Terrible. Terrible. Did you feel like coming to work and being nice and being good to everybody? No, you felt like being in your bed with your covers over your head, didn't you? So let's think about a resident that maybe has a toothache, but they can't tell us. And now all of a sudden, they're displaying behaviors that we don't know. Why? Maybe it's their mouth. Maybe there's something going on in their mouth that's causing some pain. And if we can't eat, we're going to lose weight. And for some of us, that's a good thing, right? I mean, I'd be all for it. I'd be able to eat for a couple days, right? But we don't want our residents to be losing weight. And as Mark just said, when he had a toothache, he didn't have a very good quality of life that day. And if your teeth are wiggly, if your teeth hurt, if your teeth are falling out, if you're like my grandma and you've lost your front teeth, your quality of life is not very good. Not only that, the mouth can lead to serious illness in old age. Let's talk about some of those illnesses that are connected directly with the mouth. Lung disease. We talked about lung disease with my mother-in-law, right? It's directly correlated. The mouth, the infections in the mouth can get into the lungs. We're going to talk a little bit more about that in a bit. Diabetes, okay? If someone has diabetes that you're trying to control and their mouth is infected, you can't control their diabetes. Likewise, if their mouth is infected and I'm trying to deal with that and their diabetes is not controlled, we're not going to be able to control either one of them. So it's very tightly connected. They're connecting oral disease with arthritis, Alzheimer's disease. If you have disease in your mouth, you're more likely to get Alzheimer's disease. And that's what we're dealing with here, isn't it? Dementias. And heart attack and stroke. You're more likely to suffer a heart attack or a stroke if your mouth is infected. And probably the most common thing that we experience when our mouths are infected is aspiration pneumonia. Aspiration pneumonia almost always comes from the mouth. It's food, it's bacteria that's been allowed to be in the mouth. The food starts to rot, if you will, and it's all bacteria, and we get it into our lungs, and that can kill us. So if you have people that have had pneumonia, and if they're prone to that, check their oral health, because oftentimes that's where it's coming from. After all, the mouth isn't that far from the lungs. It's all connected. The one thing I'd like you to know too is if you have residents that have dentures that don't fit properly, try and get those relined, because if they don't fit properly, they pack food up underneath of them. Okay? And then again, if that stuff is aspirated, they will be sick. And also, try to be sure that they have the names in the dentures and the partials. Do you have people that have partials and dentures? Do you have are the names in them? Excellent. It would be a good thing to be sure. I've heard, just like eyeglasses, that dentures and partials can get lost or misplaced. And there's a story of one hygienist who went in to see her mother-in-law, and the family thought that the woman had had a stroke. The mother-in-law had had a stroke, they thought. But what had happened is she had someone else's teeth in her mouth. I don't know about you guys, but I wouldn't want someone else's teeth in my mouth, right? So names in these appliances are very important. So let's look a little bit about research. It's interesting that the research has shown that toothbrushing may prevent death from pneumonia, especially aspiration pneumonia. When I saw that, I was like, you have got to be kidding. Simple toothbrushing can prevent pneumonia. That is huge. And this research said that approximately 1 in 10 cases of death from pneumonia can be prevented by improving oral hygiene. Wow. That is huge. And do you know how much a case of aspiration pneumonia costs? About $35,000 for one case of aspiration pneumonia. And how long are they out of your facility? I go to the hospital with aspiration pneumonia. We can prevent that with a toothbrush. The interesting thing to remember is that infection is infection, and it inflames our entire body. If we have infection in our toe, it doesn't just stay in our toe, right? It travels throughout our bloodstream and it goes everywhere. Everything can be affected by what's going on somewhere else with an infection. We don't have to understand all that crazy stuff in that first slide I showed. All we need to know is be like a little frog, just smile and understand that infection is infection and it goes everywhere. Again, dental hygiene perspective, tartar on the backs of the lower front teeth, okay? This is infection. This is how we deal with infection in the dental hygiene realm. It's no different than this infection that you guys are accustomed to seeing, right? It's all the same thing. The thing is that with the infections that you all deal with, you can see them. If I would take a mouth that is all infected with periodontal disease and lay all the infection out on a surface, it would be as big as the palm of my hand. If I put that infection on someone's tush, that's a problem, isn't it? If you have a bed sore as big as the palm of my hand, it's a problem. Yeah. Okay? But that happens in the mouth and nobody knows it. So, better oral health improves quality of life of your residents. They like to eat, they don't lose weight, they can smile, and they smell better. A research project that my friend Shirley over there and I did, we implemented some oral hygiene and some products in a nursing home. And when we got there halfway through the project, the care team came to us and said, we have no idea what that stuff is that you're giving Kevin, but he smells so much better that we can now take care of him. His mouth was so bad, they did not want to even interact with him. But oral care made that better. And your families of your residents remain happier if their loved ones have a good quality of life. Imagine how my family felt when my grandmother all of a sudden didn't have her front teeth. We did not feel great about that. Residents that have good oral health have less trouble with lung disease, they have fewer heart attacks and strokes, easier time controlling diabetes, they develop less systemic illnesses, and they require fewer hospital stays. And I'm thinking that your guys' goal here is to keep people here, right? So that we don't have to take them to the hospital. We want them to be able to age in place here. When I review the textbooks of nursing assistants, they put oral care next to hair care. And while hair care is very important, and it's good for self-esteem to have your hair looking good, it's not quite as huge of an issue as oral care. Oral care is infection control. I think that in the textbooks, it needs to be next to infection control, not in grooming. So let's talk a little bit, this is what I'm gonna ask you guys now to kind of have a basis of what we're talking about. I'm going to ask for you to answer a couple questions for me, okay? So, who are the people in the room taking care of oral care firsthand? Who's responsible for that? Only one? Ma'am, you're the only one that's responsible for oral care?
All the aides.
So aides, raise your hand. Raise your hand. Aides, one of you, raise your hand.
We all should be doing oral care.
Okay, so what are your biggest challenges with oral care?
Oh my God. Getting them to open their mouth.
Yes, ma'am.
On the brush when you put it in their mouth.
Yes, ma'am. So what she just said, to reiterate, is, oh my gosh, getting them to open their mouth, getting them to not chew on the darn toothbrush. I'm right there with you. I get it. What else? Anything else?
It's painful for some of them to get their teeth brushed, so they don't want their teeth brushed.
Yes. And why is it painful, do you think?
It bleeds.
Yeah.
And stuff like that.
Yeah, because they're not healthy. And obviously, if you're not healthy, that does hurt. And so we really need to have some type of a protocol so we can bring those people into better health so that it doesn't hurt. Absolutely. You're absolutely right about that. Thank you. What else? Anything? Yes, ma'am.
The toothpaste, they're not supposed to swallow it, but a lot of them will not spit out.
Correct.
So they are swallowing.
Yes. And so what she said is that a lot of people won't spit the toothpaste out. And then they end up swallowing it, right? Because they won't spit. I know. We're gonna talk about all three of these things. All three of these things, because you know what? Your guys' challenges are universal with oral care. It is what everybody talks to me about. They're like, Angie, we just don't know what to do. So I'm here to help, okay? So here we go. The resident not letting you get the toothbrush in their mouth, not opening, okay? So let them clench, okay? If they're not gonna open their mouth for you, it's okay. Let them clench their teeth, and here's why, okay? The plaque that we're trying to get off the teeth to keep them healthy often only sticks to the outsides of the teeth, okay? Doesn't really stick to the insides of the teeth much except for the lower front teeth, okay? And what we're trying to do is reduce that plaque in the mouth to keep them healthy. So if they're clenching, they're focused on clenching, and it's okay. You let them clench. And we have an amazing toothbrush, not me, I mean, this is a company. It's called Dex Brush, and it's amazing. It has bristles that are in the shape of a U, okay? So now you've got this resident clenching, and you, as the caregiver, have your hand on the handle, and you can brush the upper and the lower teeth at one time, and you let them clench. Sound better than trying to fight with them to open their mouth? Yes. And what you're doing is you're removing at least 50% of the plaque by doing that. If you're not getting in there at all, then you're not removing any plaque, right? So here is what I want to tell you. Cleaning the fronts of the teeth is better than nothing and is almost as good as cleaning the entire tooth. You are doing great things if you're brushing the outsides of the teeth, okay? The other thing is they want to bite down on the toothbrush. Okay, so when we have a traditional brush, right, just a handle and bristles on the end, and if you get that in their mouth, they open, they bite down on it, it's there until they decide to open, right? It could be 2 days from now. And you don't want them running around with toothbrush sticking out of their mouth for 2 days. This brush is perfect in that instance as well. Let's say they did open and now you're brushing with this and they clinched down on it, right? Look at how beautiful this is. You have this handle and you can flip, you turn the toothbrush and these extensions right here opens the mouth. And you can pull the toothbrush out. How slick is that? No longer do we have to worry about having the toothbrush stuck in someone's mouth with a Dexty brush. Make sense? Helpful? All right. So here is a Dexty brush. We ordered online from anywhere. I don't even know how much they are, about $3 a piece maybe. They're not super expensive, and you can just Google it. Dexty brush. So you have toothettes here in your facility. Okay. So they're better than nothing. If you can't get a toothbrush in, the toothettes are better than nothing. But you want to be able to use it like a toothbrush, okay? If that's the only thing you can get in there, use the toothet. We prefer that they're uncoated. Okay, uncoated. Everybody wants them coated because they think it tastes better. Uncoated is better because the coating dries out the mouth. And we don't need any help drying out mouths. So, Diamond, come on up here there, young lady. So, this is another thing about how to approach the resident. Okay, how do we approach the resident? So when I teach in CNA classes, when they approach the resident, what they do is they tend to grab the toothbrush and they come to the resident like this. Okay? And so we're like, okay, Diamond, we're gonna brush your teeth, right? So now what happens if Diamond decides she doesn't want her teeth brushed? She won't open, or she turns her head, right? She's like, get away from me, right? Or she's like bringing her arms up, okay? You don't ever come from the front with a toothbrush. How would you like it if someone was coming at you with what seemed like a sword? And maybe you didn't understand what it was, right? Right? I mean, you would not want that to happen. So I always coach my nursing assistants to come from the side. Of course, you tell the resident what you're going to do from the front. You never come up on them from the back and scare them. You tell them what you're going to do, and you approach them from the side. Okay? So we're here at the side. And now, if Diamond is going to be resistive, I can help her to remain steady. Okay? So, Diamond, try and turn your head once. Okay? So I'm supporting her. It's not a headlock. Am I hurting you? No. No, of course I'm not. And if you have a Dexty brush, and if she's not going to get in, you can simply get her lips open. And yes, they're strong, but you can pry their lips open and get that Dexty brush in and get the outsides of the teeth brushed. Okay? Make sense? Okay. Yes, ma'am.
Most of our people, if we on the side, true enough, but if we grab their head like that, they're all in a fight. We're getting ready. It's a fight.
Okay.
And we cannot hold their head and force them.
Sure. Yes, you can't force anything.
Right.
So I mean, if you're having someone that's flailing at you and they're like, I'm not going to do that. I'm not going to cooperate. There's nothing you can do. Okay, because you can't pin them down for anything. that you want to do. You have a right to refuse, right? So what tends to happen, though, what I see is that when we have one or two that are acting like that have those behaviors, we oftentimes say, oh, we're not going to do oral care on anybody because they're all going to resist, okay? So what we're going to talk about next is some oral care plans, individual oral care plans, so that we know how each resident is going to respond and we know which ones we can help, right? Because there are many that we can help and we know that there's some that we just can't. There are things also, I did not bring them with me, but they're like little tubes, they're Velcro, okay? And they're like plastic tubes that you can put on their arms, okay? I use these in my memory care clients because if I'm trying to brush their teeth, which I need to do for infection control, right? So that they're not gonna get sick, but they're gonna swing at me, I will just apply the Velcro arm things. They can still move their arms. I'm not strapping them down. I mean, they're free to move however they want. The only thing is they can't bend at the elbow to punch me. Okay, so that may be another thing that you consider, and those are not that expensive either for when you're doing any kind of care, you know, that you are maybe at risk, because the last thing that we need is caregivers putting themselves at risk of being hurt when they're trying to accomplish a goal, okay? So individual oral care plans, and so again, don't come like this because that's gonna be worse, okay? If they wanna wiggle, they're gonna wiggle right out of you. And I'll tell you that I really have, and my team have really pretty good luck with this technique. All of our residents that we see are memory care, every one of them. And we are successful at getting into these mouths. But again, most of us bring 30 years of experience of being in mouths, right? So we're usually pretty darn successful at being able to come to them and get the task done. Okay, and I'm willing to work with you and see a couple of your residents at some point, and maybe work with you a little bit if you'd like that.
Yeah, I mean,
couldn't hurt, right? Couldn't hurt. So maybe we could do something together. Thank you, Hyman. Awesome. All right. So the spitting resident, we talked about that too, and the toothpaste. Well, the toothpaste companies want to sell toothpaste, right? That's what they want to do. So they show us these commercials of toothpaste and a nice little swirl on the end. You don't need that much toothpaste. You only need a pea-sized amount of toothpaste. We typically don't even use toothpaste. Interesting. What's the reason we use toothpaste? What is the clinical reason that we use toothpaste? Fluoride. Yes, that's the only reason that we use toothpaste. And it makes the breath feel fresher and all that jazz, but it's not necessary. So we do mostly dry brushing, and then at the end, we will take our little pea size of toothpaste and just smush it on their teeth, and we leave it. Our residents don't even rinse their mouth. What? Most of my residents that I care for can't even talk to me, so how can they rinse their mouth out? They can't. So dry brushing is very effective to remove the plaque. Okay, and no toothpaste is fine. And if you want the benefit of the fluoride, you put a pea-sized amount on that brush, or if you want to put your finger to swab on the brush, swab it on the outside of the teeth and leave it. That amount of fluoride in that bit of toothpaste will help the teeth a lot, and when they swallow it, it will not harm them. I like that. I know, isn't this the best? Right? So we don't have to deal with being spit at. And then we've got all of this stuff too that's like foaming out of their mouth, and now we're a mess, and they're drooling, and I'm like, what am I supposed to do? How am I supposed to clean this up? So dry brushing. So this drives me nuts because what the CNAs learn in their textbooks is that you need to brush every resident's teeth 3 times a day and floss them once a day. How ridiculous is that? You cannot do that. You cannot do it. I know, I've been in your world enough to know this is unrealistic what the textbooks teach you. I say once a day. The plaque grows out on the teeth once every 24 hours. So if we can do a pretty good cleaning once a day with a toothbrush, we're doing good. So individual daily oral care plan, resident-centered care approach. When does that resident prefer to have their teeth brushed? When are they least agitated? Is that in the morning? Is it in the afternoon? Is it in the night? What team member, what shift is now going to be responsible for George's oral care? Who's going to be responsible for Mary's oral care? Okay. What kind of a toothbrush do we use? We need to write all of these things out and have this individualized resident-centered care approach to oral care. And you get it done once a day. And they will be healthy. The cool thing is that you guys know your residents best, just like you said to me. It's like, oh, I know there's some residents aren't going to allow that. Right. You know that better than me, right? So you know how to approach what people, how, and when their better times of the day are. You know how to work it out with the resident better than I ever will, because you're here all day, every day. You can get it done. So based upon what you've heard, I know we're running out of time, we're almost done. What you've heard this afternoon, what may you do differently the next time you approach someone for oral care? What might you do different?
Come from the side, that's the good thing, not going to the front.
Yep, come from the
So,
side.
I like that dry toothbrush.
Dry toothbrushing, yes.
You know, the moisture in their mouth should help with the toothbrushing up.
That's right,
Oh my God.
that's right.
It's so much better than all of that toothpaste. And so there's some of them, the toothpaste makes them gag.
Yes,
Toothpaste gags me. I can only use a little bit.
and that's all you need. And if it's too big of a challenge to use it, don't use it. Try and get the fluoride toothpaste in the mouth after you brush the teeth. Anything else? Anybody? So I want you to know, we're getting ready to wrap this up, that we can help you in the future. We're on your side. We love to come alongside of you and help you to keep your residents healthy so that they can have a good quality of life through this process that they're going through. So we do care team training, which we've just done. We do care team support. We develop camaraderie with the residents and the families. It's amazing how we develop the relationships when we're with these people once a week, and the relationship that develops. We do family group presentations to talk about what we do, and we provide oral health advocacy. That means if someone has a dental issue, we can work with you to try and figure out, can we get dental care for that person? And if we can't, what are we going to do to stop that disease? And if all of that isn't enough, we do provide oral care services. So we do come in and brush and clean between the teeth on a weekly basis for people that really just need that extra help. Our program also brings xylitol toothbrushes and toothbeds. And that's all based on research, okay? Research shows us that weekly brushing can improve oral health, and when we do it every week, we can maintain the oral health. So that's what this program is based upon. I don't have a lot of time to go into xylitol, but I want to just tell you right quick that xylitol is a natural occurring sugar. Has anyone heard of xylitol before? We put it in, I don't, companies put it in things like toothpaste, mouth rinse, gum, and mints. And we then, with our clients, we have them having xylitol every day in the form of gum. If they can't do gum, they do mints. If they don't do mints, they do a tooth gel that is just put on their finger or on toothpaste and just wiped on their upper front teeth to get the xylitol in the mouth. The bacteria then eats the xylitol, and the bacteria can't do their job. So they can't create the dental disease. That's part of our program as well. There's some of the products. This is kind of what we can achieve with xylitol. This was in my research project. This is disclosing solution. Everywhere you see blue, that's plaque that's been on the teeth for longer than 24 hours. Okay, this is how we found this resident. This was in 6 weeks on that xylitol protocol, and this was in 12 weeks on the xylitol protocol. There was no brushing happening here at all. This gentleman is schizophrenic and does not allow anyone in his mouth. So just by incorporating the xylitol, this gentleman is far less at risk for aspiration pneumonia and other illnesses than he is here, with less debris on his teeth. This is another client that we saw. You can watch the bacteria go from blue to red, again, simply with the xylitol. This is an easy way for those folks whose mouths you can't possibly get into. The xylitol is an easy way to keep them healthy. Our mission is enhancing lives at High Life. We work with people to enhance the lives of the care team, of the residents, and of the family members. I do have a book. It's an Amazon bestseller called Dying from Dirty Teeth. It has a lot of this information in it. I will leave you with a copy here for the facility. So if anybody is super duper pumped up about oral health now, you can read my book. It's also, you can order from Amazon as well. So I'd like to thank you. If you have any ideas or thoughts about how High Life may be a service, a help to your community with education, support, things like that, actual services, please let me know. I have some brochures here on the table. And also, if care team, if you know that you have a resident that you've seen some of these issues with, please tell someone so that we can hopefully get that patient healthy so they don't have to suffer physically from what's going on in their mouth. Thank you very much for your time and attention. And if you have any questions, I can answer, but I have to be at your other building here for another presentation in 10 minutes. Thank you, everyone. Are there any questions? I have toothbrushes for everybody. So if anybody wants to take a new toothbrush, you're welcome. And I do have some gum here that has xylitol in it if you wanted to try the gum. So help yourselves, okay? And I'll answer